It's World Diabetes Day. I'm here to add my voice, not because I am an eye doctor, but because I have first-hand experience losing a loved one to diabetes and its complication. I must tell you, diabetes is one condition, one disease that feels invisible, but its impact is undeniable. I'm Dr. Ebeogu Wisdom. I'm going to be discussing how diabetes affects your eyes. Diabetes, as we all know, is a persistent metabolic condition characterized by increased blood sugar levels. And this can be due to deficiencies in insulin secretion or the function, or even both of them, where the body cannot produce enough insulin, or that the tissues are not sensitive enough to it, or even the both happening at the same time. The prevalence of diabetes is escalating on a global scale, evolving into a public health concern. In 2022, it was estimated that about 828 million people, million adults worldwide, are living with diabetes. And guess what? There is a projection that by 2050, these numbers can get to about 1.3 billion. And this is as a result of aging population, of course, urbanization, obesity. People eat diets that are not appropriate, and several factors like that. How does diabetes affect the eye? Diabetes affects the eye in several ways, starting from the anterior segment to the posterior segment, causing problems like cataract, glaucoma, macular edema, retinopathy, and even in some cases, it can predispose one to recurrent eye infections and dry eye condition. The eye is not the only organ that diabetes affects. It affects even the kidneys, it affects the heart, the nerves, causes a whole lot of neuropathy. So let's talk about the things that readily happen to the patient who has uncontrolled blood sugar. One of the things they present with is blurry vision. As a matter of concern, diabetes have a way of changing the refractive status of an eye if the blood sugar is not kept under control. Then secondly, diabetes can get an individual to start developing cataract. Excess glucose gets trapped into the lens, and this glucose will be converted to what we call sorbitol, and this makes the lens become cloudy. And a middle-aged person suddenly develops cataract. Because we know that cataract is age-related, but in raised or uncontrolled diabetes, one can easily have cataract. There is one irreversible cause when sugar is not properly managed, or when somebody has been diabetic for so long, it affects the retina. How does it affect the retina? The retina is majorly vascularized, and we know that diabetes is a vascular disorder. It gets the blood vessels, the blood vessels at the back of the eye, and weakens them, that they get susceptible to bleeding. They can start bleeding. You start seeing dot and blood hemorrhages. And in some cases, when you also have cholesterol problems or hypertension, because most times they flock together. Why we are raising awareness on diabetes is because it could be very silent at the early stages. It could be invisible, not knowing that when sugar is not controlled, cumulatively the effect wearies the body, wearies the organs, and can lead to permanent disability. Take care of yourself. Stand up today and find out what your glucose level is. And if at all you're diabetic, take actions to taking your medication. Track your diabetes. Take actions. Take care of yourself. Take your medications. Eat right. Take the right diet. Then do your exercise. Don't be inactive. And also go for regular examination. A proper dilated annual eye examination will check the whole quadrants of the retina, and if there are areas identified to be bleeding, such can be controlled before it escalates. Take action today. Thank you.